Tonight I worked with two patients, and they reminded me of something many people misunderstand about mental health. A lot of people think recovery from mental illness is mostly about medication or therapy. And those things can absolutely be important, but sometimes an important piece of the puzzle is something much simpler. Movement. Hi, I'm Dr. Michael Harrington. On this channel, we talk about psychology, mental health, and the science behind human behavior. Earlier this evening, I had two consultations. One patient was referred to me by a professor in Ontario, Canada. She's dealing with obsessive-compulsive disorder, or OCD, along with pretty significant anxiety. The second patient lives in Boulder, Colorado, and has been diagnosed with major depressive disorder with what clinicians call anxious distress. Now, these two cases might sound very different, but they actually highlight something important about how mental health conditions develop and how recovery often works. In diagnostic systems like ICD-10, depression is usually described based on severity. For example, mild depression, moderate depression, or severe depression. Clinicians may also note certain features, like somatic symptoms or psychotic symptoms. But in real clinical practice, many clinicians also talk about different patterns of depression. You might hear terms like anxious depression, atypical depression, melancholic depression, or psychotic depression. These aren't separate diagnoses. They're simply ways clinicians describe how depression shows up in different people. Now let's go back to the first patient, the one with OCD. OCD usually begins during adolescence or early adulthood. Men and women are affected at roughly similar rates, although men sometimes develop symptoms a little later. Another important thing to understand is that OCD often shows up alongside other conditions, most commonly anxiety disorders or depression. In fact, comorbidity is very common in OCD. The patient I saw today was experiencing strong anxiety in addition to obsessive thoughts and compulsive behaviors. When people think about treating mental health conditions, they often focus on medication, and medication can absolutely be part of treatment. But in real life, recovery usually depends on several things working together. Three of the most important are appropriate treatment, stable daily routines, and regular physical activity. And interestingly, exercise is often the hardest one for people. I've worked with many patients with depression whose physical condition has gradually declined. Some of them feel exhausted after walking just a short distance. They tell me they have no energy, no motivation. They just don't feel like moving. So they stay inside, they sleep a lot, scroll on their phones, play games. Over time, their lives become very sedentary and isolated, and that can create a difficult cycle. The less someone moves, the weaker their body may start to feel. And when your body feels weaker, it becomes even harder to find the motivation to move. From the perspective of modern medicine, mental health and physical health are deeply connected. In psychology, we often talk about the biopsychosocial model. The idea is that biological factors, psychological factors, and lifestyle factors all interact. Exercise is interesting because it affects several of those systems at the same time. Regular physical activity has been shown to increase blood flow to the brain, support healthy dopamine and serotonin activity, and help regulate stress hormones like cortisol. Research also shows that people who stay physically active tend to have lower rates of depression and anxiety, and better emotional resilience. Personally, exercise has always been a big part of my life. Over the years, I've received different professional recognitions, but the one that still means a lot to me is actually very simple. Back in 2015, my fitness center gave me an award for best physical fitness among several thousand members. And honestly, I value that one a lot. Because over the years, I've seen how strongly physical health can support mental health. After many years working in psychological counseling and psychotherapy, I've come to believe something fairly simple. Beyond medication, two things can make a powerful difference. One is regular physical activity. The other is developing a stronger sense of meaning and purpose in life, something many forms of therapy try to help people build. But even without that deeper work, regular movement alone can make a real difference. So if you're struggling with depression, anxiety, or OCD, here's one simple suggestion. Try bringing a little more movement back into your daily life. You don't have to start with intense workouts. Even regular walking is a good start. For many people, Consistent movement over time can lead to real improvements in mood, energy, and overall well-being. If you're interested in learning more about the science behind this, I highly recommend the book, Spark: The Revolutionary New Science of Exercise and the Brain. It does a great job explaining how exercise affects the brain. Thanks for watching. This is Dr. Michael Harrington, and I'll see you in the next video.